Would I be a candidate for transconjunctival lower blepharoplasty? I want to explore options outside of fillers, and surgery seems like the best option. But I'm not sure that I'm a candidate for surgery. What are my options outside of fillers?
Thank you for your question. You submit a single photo and you're asking if you would be a candidate for lower eyelid blepharoplasty as an alternative to the use of fillers. So, you submitted a photo of a close-up of your eyes. Well, I can certainly give you my perspective on how I counsel patients like yourself who come to my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and certainly this type of question shows how the world continues to evolve in our field. And not so long ago, the question was always asked, are there fillers that can be an alternative to blepharoplasty? So it's understandable why you're asking this question, because certainly a lot of people would suggest to you to do fillers. So I'll give you an understanding of my thought process as well as how I counsel my patients about the role of fillers versus surgery and in the whole context of your appearance. So to begin with, we have to first start with anatomic definitions. Very quickly, people are eager to jump to solutions. And very often, the solutions that are being offered are based on the bias of the practitioner. So if you go to someone who just does skin, they may say, well, just do laser. And if you go to someone who only does injectables and non-surgical, they'll say, well, you need to just do injectables. And so I can understand why it gets confusing. So let's start with, first, the anatomic issue. You have puffiness under your eyes. Now that in itself means that you have something called lower eyelid fat prolapse. This means that fat that's normally around your eyes has pushed forward and is causing a certain amount of puffiness. Prior to fillers, transconjunctival blepharoplasty would be my recommendation. And certainly it is a valid approach because it is a definitive approach. And although your puffiness may not be that significant in the grand scheme of things, you can certainly, and I think you're already seeing that, is that if you do a procedure like a lower eyelid blepharoplasty, you're essentially, for that particular element of your facial appearance, you're basically done. You're not going to need to keep going back and forth for fillers. A lot of times, I've observed that people develop something called filler fatigue. They go for injectables in an area that particularly is challenging. The under eye area it requires a lot of finesse to get a beautiful result with fillers. And dealing with some of the downsides, such as bruising and swelling, can make someone think twice about wanting to do it again. So in a situation like yours, it would be typical for me to recommend lower eyelid blepharoplasty to help with the dark circles and the skin color and quality. I would use platelet-rich plasma, and I might even consider a very light laser, depending on what I would see in a three-dimensional examination. Now that being said, when I talk to my patients about lower eyelid blepharoplasty, they are often concerned about the paradox of hollowness. The hollowness being prior to blepharoplasty, where they feel the valley next to the puffiness is hollow. So then I show them often that if you look from a side view or a three-quarters view, there's actually volume loss below the rim of the bone called the orbit. And so there may be still a value to fillers, but not exactly in the same place. There may be a value to place fillers at the eyelid cheek junction or in the cheek area to help blend. But that's really more of what I call icing, or a further enhancement of the global area and not specifically for the under eye puffiness. So the art of doing lower eyelid blepharoplasty in a situation like yours is knowing how much to sculpt and how to maximize the outcome and contour so that it looks natural and it doesn't look like you've had surgery. So just from the photo alone, I would suggest that you are probably a candidate for lower eyelid blepharoplasty. So I would recommend you meet with a qualified, experienced cosmetic surgeon who does a lot of eyelid surgery and learn about your options. Like I said, from my perspective, you would be someone I would generally do a procedure like transconjunctival blepharoplasty and PRP, platelet-rich plasma, derived from your own blood to stimulate the skin quality, growth factors that generate collagen blood supply, and possibly a type of fractionated laser. So again, meet with a qualified doctor, maybe get a few opinions, and go with the doctor you're comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.